Tonight we have an exciting topic being given by our very own pediatrician, Dr. Teykia Deveaux, and we are talking about breastfeeding and the importance of it in our community. So let me say a few words about our presenter, and I will quickly turn it over to her. As a quick note, August is Breastfeeding Awareness Month. I think the first week of August is actually Breastfeeding Awareness Week, and so we felt it quite necessary and timely to do our lecture series towards the end of July talking about breastfeeding. So, our presenter tonight is Dr. Teykia Deveaux. She's an American board certified pediatrician with over a decade of experience in pediatric care. She earned her medical degree from Howard University College of Medicine in Washington, D.C., and completed an internship at Nagoya Red Cross Hospital in Japan. Following her internship, she completed her pediatric residency at St. Vincent Hospital. Dr. Deveaux has a rich background in serving underserved communities, having worked on the east side of Indianapolis. She has since returned to her home country, where she currently serves as a consultant at Doctors Hospital Health System and an assistant professor at Western Atlantic University School of Medicine. She holds special interests in breastfeeding, medicine, and pediatric mental health, and is a certified lactation consultant and pediatric mental health expert. In her free time, Dr. Deveaux enjoys traveling and playing tennis. She is married to Mr. Dennis Deveaux and is a dedicated mother to their daughter Meredith and son Dennis Jr. So I am happy to be joined by and welcome tonight to our virtual distinguished lecture series, Dr. Teykia Deveaux.
Good evening, and thank you, Alexis, for that introduction. I'm happy to be here to talk about something that's very important and special to my heart, breastfeeding. So I will jump right in. So tonight we're just going to briefly chat about the benefits of breastfeeding, some of the challenges that moms can face, as well as community support that is needed for breastfeeding mothers. And last but not least, some of the common myths and misinformation about breastfeeding that seems to be out there in the community. So what is breastfeeding, right? It's literally the simple act of feeding a baby from your breast, right? That milk can actually be expressed and then served in a bottle or a cup, but it is the act of feeding a baby from your breast. There are tons of benefits to breastfeeding your baby, and I could spend all night here, but I will just give the highlight and key points for the benefits for your baby. Number one would be optimal nutrition. So for babies, especially for the first 6 months of life, your breast milk will include just about every single thing that the baby needs. The only thing extra that pediatricians will recommend to you would be to give the baby that is exclusively breastfed for the first 6 months of life vitamin D. And there's a specific dosage that we recommend. So it has the water, it has the carbohydrates, it has the protein, and all of the fat in the necessary ratio that is needed for your baby. And so, fun fact, breast milk is actually a living substance and it adapts to your child's needs. So it's very easily digestible compared to formula. It provides immune support, so strengthening your infant's immune system, reducing the risk of infections and illnesses such as diarrhea, ear infections, and respiratory infections. So lots of good stuff in that living substance. And then last but not least, long-term health, right? So breastfed infants will have a lower risk of chronic infections as they get older. And those infections or conditions really would be asthma, type 2 diabetes, even type 1 diabetes, as well as certain cancers. So breast milk is the gift that keeps on giving. So what are the benefits for the mom? Well, there are tons there too, right? We have good help with postpartum recovery. And so moms that will breastfeed, we find that their uterus will go back to that pre-pregnancy size a little bit faster. During that recovery phase, we find that breastfed moms that are breastfeeding, their postpartum bleeding decreases a little at a faster rate as well. And so we really want to highlight and emphasize the importance of breastfeeding with our moms, right? There are long-term physical health, right? So there is out there that moms that breastfeed will get back to their pre-pregnancy weights a little bit faster. There is a caveat, right? You have to also eat well as and breastfeed. So you can't, eat bamboo shack 3 times a week or 4 times a week and then expect to have that weight fall off. You have to eat well and burn those. The breastfeeding actually burns about 500 extra calories per day. It's significant work and good for weight loss if you do it with the caveat of eating well. And so breastfeeding also decreases a woman's risk of certain breast cancers and ovarian cancers. So the time that you spend breastfeeding 6 months, 12 months, as long as you even go, it will decrease your chance of developing certain types of breast and ovarian cancer. And then last but not least, mental health. So breastfeeding, we have found that has decreased the risk of women developing postpartum depression. And this is a little bit different from postpartum blues. Postpartum blues usually resolves within, the first 2 weeks, 3 weeks after delivery. But beyond that, when it's affecting the way you carry out your daily life, you're having thoughts that are intrusive, or you're unable to get out of bed, having difficulty bonding with your baby, that leans more to the area of postpartum depression. And so we definitely want to encourage breastfeeding and be more aware of that mental health issue that can come along for moms, but especially new moms when it's their first time. We have lots of economic benefits from breastfeeding, right? We're saving on formula. Formula is very expensive. And so breastfeeding eliminates the need of toting hot water around to mix your formula. You're just able to literally whip your breast out and feed your baby. It does require some prepping and planning. If you're going to leave your baby with another caretaker, you would have to pump, etc. But generally, it's cheaper and basically free, leading to significant cost savings, sometimes saving hundreds and maybe thousands of dollars for families. And in this day and time, every dollar definitely counts, right? We're saving on healthcare dollars because the babies that are breastfed, we talked about the fact that they will have less ear infections, less respiratory infections. But with that being the case, that means there are less time in my office as a pediatrician. They're not frequenting the hospital. So therefore, we're saving healthcare dollars by encouraging moms to breastfeed and being a good partner in the community. It's also beneficial for our community health. Healthier infants, healthier moms means a less burden on our healthcare system and a healthier community overall. And then last but not least, environmental savings, right? Breastfeeding is environmentally friendly. There is pretty much zero carbon footprint from breastfeeding. You're not having to make anything, you're not having to package anything, you're not having to transport anything. Literally, the woman's body is doing all of the work. And so therefore, there's tons of environmental savings from that. There's no use of resources outside of the mom's body. And so very important benefit that we find economically for breastfeeding. So I wanted to spend some time just to talk about the challenges some moms will face when breastfeeding. It is not easy. So there are physical challenges moms may face, emotional challenges they will face, and sometimes social and cultural barriers that we also may come across. And so, like I said, breastfeeding is not easy. Let me repeat, it is not easy. It is hard work. Lots of benefits. Easy? No. But can it be done? Absolutely. And so with some moms, you'll find there's the initial pain and discomfort when they're latching, the baby's latching for the first time, the first 2 times, maybe for the first few days or even up to the first 2 weeks, right? And so it's really important to seek professional help if moms are having difficulty getting their babies to latch so that they don't have to endure pain and discomfort. But I will be very transparent. It is not a very easy process, and there is some discomfort associated with it at the onset, right? So I love a quote by the La Leche League where they just basically say that breastfeeding is natural, but it's not as natural as breathing, which is automatic. It's more natural, like walking, where you have to learn how to do it over a certain period of time. And so, what other challenges you may face physically? Sometimes moms can develop an infection. They can develop mastitis. They can have blocked ducts, right? They can have cracked and sore nipples. This is kind of power for the cause, but with proper education from your lactation consultant or your pediatrician, you are definitely able to overcome these challenges and hopefully have a successful breastfeeding journey. And so, what emotional challenges are my mom sometimes will face? Well, can I really do this? Am I making enough for my baby? No one wants to starve their brand new baby. And that is one of the most important questions we're asked as pediatricians, we're asked as nurses in the hospital, is the baby getting enough, right? And everybody wants to feel comfortable that their baby is well fed. There are three things I require from a newborn or an infant, and are you pooping? Are you peeing? And are you eating well? And so we want to be able to answer all of those questions in the positive affirmation. And so stress and anxiety about milk supply is probably one of the number 2 or 3 complaints I get as a lactation consultant. And then talking about feeding schedules. So only about 10% of women physiologically cannot breastfeed. And so that means for the other 90% of us, as someone that's breastfeeding right now, we can do it. A lot of people don't try or they may give up because of the challenges that I indicated earlier. But here we are talking about the challenges and how to overcome them, and really the importance of doing it for the infant's health as well as the mom's health. And last but not least, social and cultural challenges we may face, right? So the lack of support in the communities. It's very important that moms have support not only from their spouse, but their extended family, their grandmas, whoever is in their quote unquote village that's going to help support that baby, right? And if you have stuff like, oh, I think that baby is not getting enough. I don't know if your breast is springing enough, but your pediatrician is saying, yes, the baby is growing well. You should have some trust in your own body that your body can do it and supply and nurture the baby that you grew in your belly for the past 9 months, and know that you can continue to sustain them at least for the first 6 months on exclusive breast milk, if that is your desire. So it's really important to have that support in the community, and then balancing these breastfeeding with your other responsibilities as a wife and maybe as a mom of other children. It becomes a part of the family's fabric and their household duties, but it's a lot of work. So carving out that time that is needed to attend to the breastfeeding journey is going to be really important. So we want to spend some time talking about the community support and having effective community support. And what does that exactly look like, right? We want to talk about support emotionally and psychologically. It requires practical assistance and definitely educational resources, right? A lot of times we do Google what if we're trying to find information, and sometimes Google is correct and sometimes it's not. I feel like Google always ends with, but you could die from this, right? And so you want to make sure you're getting good information about breastfeeding, either from us here at Doctors Hospital or whoever in the community that is a trusted healthcare provider. So community support looks like your healthcare professionals, your nurses, your physicians, your lactation consultants. They all play a vital role in providing medical advice to our breastfeeding moms. And we must train our healthcare professionals to be advocates for our moms so that they can receive the support and help that they need. This support also looks like peer support groups, right? Connecting new mothers with others that have been successful at breastfeeding or moms that are breastfeeding at the same time. And so this creates a network of shared experiences. And believe it or not, that is super helpful when you're able to talk to someone that is also in the trenches with you, right? They're at that 2 a.m. They understand the baby didn't latch at 2 a.m. or maybe they latched at 4 a.m. or they were up at every hour for a cluster feed. Having that group of people to talk to, maybe even it's just 1 or 2 moms, just so that you can vent. It's something that only another mom would be able to understand is going to be important. Community support also looks like family and friends. So moms, dads, grandmas, the Grammys, the great Grammys, it's really important that you positively speak about breastfeeding to a new mom that's interested and engaged and want to breastfeed her baby. Encouragement goes a very long way, right? And then for our workplaces, breastfeeding support looks like maybe lactation rooms. That would be ideal, but it also looks like flexible schedules where patients, moms are able to take time from the day and able to be able to breastfeed and pump for their babies. You may not be able to dash out in Nassau's traffic home to feed your baby, but you should be able to at least take a break for 15 to 20 minutes in a room, right? Not the bathroom. Nobody else eats in the bathroom, so I don't expect a breastfeeding mom to have to pump in the bathroom, but have a dedicated space so that the mom can breastfeed. It goes a long way with your breastfeeding journey. I've done this. This is my second time around, and I've been fortunate to have employers that have been really on board with supporting the breastfeeding journey. Obviously, the first time I was working at a pediatric hospital. That's a no-brainer, right? We love babies. Breastfeeding is number one on our game. This time around, even teaching at a medical school, we needed to frost my glass, so I had privacy and people couldn't just walk past the door while I'm breastfeeding. And that is what breastfeeding support looks like in the workplace. And last but not least, it looks like community initiatives, right? We talk about breastfeeding. We don't quite know how we're supposed to do it, how long we're supposed to do it for, who's going to help us, right? And that's what we're doing here today at Doctors Hospital, is just to kind of give that information to you, provide good information that's evidence-based, right? And to eventually, we have some upcoming breastfeeding classes that we're going to be offering to the community and our patients here, doctors, and eventually more public health campaigns so that we can all reap the benefits of having moms breastfeed in the society. And so community benefits: increased breastfeeding rates, healthier community; improved health outcomes, healthier community; economic benefits, reduced healthcare, use of healthcare, our healthcare system, and contributing to the savings of our healthcare dollars. All of these are essential benefits of breastfeeding, right? So the gift that keeps on giving. And we'll just quickly wrap up with some common myths about breastfeeding, right? One would be breastfeeding is easy. I think I've said it already. It is absolutely not. Breastfeeding takes practice for the mom and the babies. It's something that has to be learned. And for some, even if you've done it before, every baby is different, right? My first daughter, it took about 2 weeks for her to get her life together, and my son did the same. And I knew it was coming, but it still felt very hard during that period. And so it's really important to know that it is not an easy process. It's natural, but it's not automatic. And so to give moms that space to learn is going to be very important. Another myth: you should only eat plain food while breastfeeding. That's not necessarily the case. Now, you may have had some restrictions from your OBGYN while you were pregnant, but once you've delivered, there's really no significant restrictions in terms of food for babies. What we do advocate for is a balanced diet. For me, I wanted some crab and dough after I delivered, and crab and dough is what I had. But for other people, whatever your desires are, breastfeeding does not really have any significant hinders in terms of your diet, unless you find that there's some allergy for your baby, and that's definitely a discussion to have with your pediatrician or your family physician, and they can guide you a little bit better on what to do there. Another myth: you can never use formula if you want to breastfeed. That's not true. Sometimes formula comes in clutch. Some things happen. We could have, a natural disaster, and the frozen breast milk that you had is no longer good, and formula is there, you use it. At the end of the day, a fed baby is best, right? And so we're not going to do anything to jeopardize your baby's health just because of breastfeeding. We do encourage it, we do push it, but we want to be very smart about it as well. And so if you're breastfeeding and you have to go to a conference and you only have enough milk for 2 days and you're going to be gone for 3 days, absolutely, formula is there as an alternative. We are grateful that we have that alternative. And then when you get back into town or while you're away, you continue to breastfeed so that your journey continues seamlessly. Next would be: many mothers can't produce enough milk. Well, breast milk production is determined about 3 things, right? It's how well the baby is latched onto the breast, the frequency of the breastfeeding, and then how well the baby is removing milk with each feeding. And so almost all moms will produce just enough milk for their babies, right? I can't produce enough milk for somebody else's baby, but my body knows what my baby needs. And so only, like I said, about 10% of moms physiologically cannot do it. The other 90% of us, and we're grateful to, it's possible. And then another one, babies who have breastfed are clingy. This one, babies are clingy. They are decidedly like they are yours. They are 100% dependent on you for every single thing. And so breastfeeding provides not only the best optimal nutrition for infants, but it also provides for their developing brain. And all babies are different. Some are clingy even if you didn't breastfeed, right? You'll have babies that are bottle fed or formula fed and they are still clinging. That is nothing to do with breastfeeding. Another myth, it's hard to wean a baby if you breastfeed for more than a year. So the recommendations from the American Academy of Pediatrics, from the World Health Organization, is really exclusive breastfeeding for up to 6 months. And then we start to introduce complementary foods beyond 6 months and beyond, right? And some people will suggest stopping at a year or at 2 years, but really it's whatever is desirable by the mom and the baby. Some babies will decide at, 12 months, 15 months, I don't want it anymore, and then that's that. Or moms may decide that they would like to wean at that point, and that's totally fine as well. But we do recommend exclusive breastfeeding for the first 6 months, and then once there's 6 months, you're introducing complementary foods from 6 months and beyond, okay? Another myth, if you go back to work, you'll have to wean your baby. Definitely not the case, right? Here in the Bahamas, we have about 12 weeks of maternity leave, and then most of us are back to work. And so if we want to continue to breastfeed, we will have to pump at a regularly decided schedule so that we can bring that milk home for our babies to have during the day. And you don't necessarily have to wean your baby at that time. Is it tough? Absolutely. It's a whole extra bag or really everything. You have to take the pump, you have to take the bottles, you have to rinse the bottles. Sometimes it takes your lunch break, right? Depending on how flexible your workplace is. It definitely requires commitment, but can it be done? Absolutely. Another myth, my breasts are too big or too small to breastfeed. Any breast size is capable of breastfeeding and producing a good supply of milk. I have seen all the spectrums, to be honest. So from a cup size A all the way up, they can all produce milk, and sometimes you'd be surprised that the smaller sizes are the overproducers. And so it just really depends on the baby, what's required from the baby, again, how often the mom is putting the baby to the breast, and how efficient that baby is removing the milk from the breast of that mom. So the size is not a big deal. And last but not least, I can't get pregnant while breastfeeding. Boy, do I think that's a recipe to get pregnant again, right? So yes, there is some period during the initial breastfeeding, when you start breastfeeding, that you will be less likely to get pregnant. I probably can just pull any OBGYN and they can tell you of a patient that came in and that their 6-week check, it's time for an ultrasound because there's another baby there, right? So while, yes, you can, if you're having strict practices, you can experience some protection from getting pregnant again. It's really important, if you're decidedly not wanting to be pregnant again, to enlist some form of birth control and not leave breastfeeding as your only method. And so that's all I have for you this evening. And if you have any questions, we're happy to field them. And I will turn it back over to Alexis.
All right, so we do have a few questions coming in from the audience. Let's see if we can pull those up right quickly. So I'm sorry, I didn't mean to laugh. As a dad, I'm interested in this question. What is the role of the father in breastfeeding? So there's a couple of questions in this one, so I'll start with that and then I'll come back with the others. So, what is the role of father in the father in breastfeeding?
The role of the father in breastfeeding is to support mom and baby, right? You are the one to go get water to make sure mom stays hydrated.
Mm-hmm.
That balanced diet I talked about, that's you. That's you. Washing bottles for pumping parts, that's also you. Mom's doing all the heavy lifting. She's burning an extra 500 calories a day to feed the baby. She's putting taking the baby to the breast. And while it seems like a very, glamorous job, sometimes it's uncomfortable. I think the role of dad, especially, is to really support the mom, give her breaks when needed, make sure she takes a shower, make sure she ate that day, take the baby when the baby's not eating. Support, support, support.
Mm-hmm. Another myth someone mentioned is that the baby will get gas if the mother doesn't eat.
And so if we don't eat well, right, whatever we aren't doing to our bodies, our babies will experience some of that. And so sometimes you can find if you're not eating well, then your baby's not getting proper nutrition, correct? So what the baby's going to take, your body is making breast milk based on what you're eating and what you're drinking. So if you're not having good proper nutrition, of course, babies will have some sort of symptoms from that. So it's important to have that well-balanced diet.
Okay. Another attendee mentioned that when the last time they breastfed, which was about 12 years ago, they had the issue with the soreness and the cracking of the nipples to the point in which, the nipples were bleeding. Mm-hmm. She wasn't aware that she was bleeding, and therefore her breastfed baby the milk had blood in it. She's asking, how can she prevent that from happening again?
Yeah. So a lot of times cracked nipples has to do with not having a good latch, a deep enough latch. So the baby's latching onto the nipple, but not the breast itself. And the nipple takes a lot of trauma, and therefore it will crack and bleed. Blood mixed into the breast milk is usually fine. You can feed it to the baby, and that's totally okay. But for mom, it's not comfortable. So definitely seeking out help from a lactation consultant or a pediatrician that's comfortable with breastfeeding would be my good recommendation for her.
Okay. Another question we had that came in was about, what is the recommendation if the mother has an illness in terms of breastfeeding? Is it recommended that she not breastfeed? Is that situational depending on which issue it is? But can you speak to that?
Yeah, so moms will get sick at some point, and you can't really stop breastfeeding, right? Because your supply is dependent on that baby latching and then pulling off milk, and so telling your body to produce more. So if it's a respiratory illness like the flu or something like that, obviously mask, good hand washing, but
Mm-hmm.
still try to breastfeed the baby, and then maybe have that dad who's giving good support take care of the baby as probably the main caretaker, but you should still continue to breastfeed. And do remember, I said that breast milk is really a living substance. So as the mom is developing antibodies for her illness, she's also able to pass that on to the baby as a benefit.
Mm-hmm. So I guess as a follow-up to that, are there any specific situations or conditions where breastfeeding might not be recommended?
Yeah, so at least for the CDC, breastfeeding is contraindicated in moms with HIV, especially if they're not on medications that has suppressed their viral load to pretty much zero, right? And if you have the Ebola virus, we don't recommend breastfeeding. And if you're on any illicit drugs, so not necessarily marijuana, but cocaine or PCP or anything like that, and you're not in a treatment program. So we do have moms that are trying to quit that habit and they're on a methadone program, and we allow them to breastfeed. But if you're taking illicit drugs, we don't want that to pass in the breast milk to your baby.
Okay. We have another question. Are there plans to improve awareness for new moms from medical professionals as it pertains to breastfeeding?
Yeah, that's our whole goal here today, is to get the conversation going, to be more active in providing that information as a resource to the community here in Nassau and throughout the Bahamas. And like I said, we have some upcoming breastfeeding classes and new mom classes coming up here at Doctor's Hospital.
Okay. I think that, we have one more. So after my baby turns 6 months, how can I make the transition from breastfeeding to other alternative feedings as easy as possible?
So at 6 months, babies will actually start to show some interest in what you're eating, right? You're looking for those cues before you just start giving them stuff. And then you're going to make sure what they're eating is appropriate for their age. So we like to make sure babies are able to sit up with at least support and have good head control before we're introducing solid foods. peas and rice is not going to be the first selection, but maybe some watered down oatmeal or baby oatmeal, mashed bananas, things that are very thin, stage one baby foods if you prefer to buy them. But if you steam down vegetables and add a lot of water to it, so it's very thin, that's really the way to start introducing. And you just introduce what you can to the babies, whatever's in your natural diet. Now, if you're in a bamboo shack diet, that's a little bit different. But if you're eating a good balanced diet, just start to introduce to your 6-month-old and beyond.
Mm-hmm. Is there any mandatory updated skills training for OBGYN? So someone is saying their experience was that their OB told them that they should start breastfeeding their toddler, and they became pregnant with their second child. So is there, I guess, like how we're talking about the new moms, is there anything else like that for healthcare providers where we're providing updated information?
So, I mean, we as healthcare professionals, we're kind of responsible for our own education and keeping up with our the latest data on providing care and providing advice. But we're in specialty fields. It's very vast. Medicine is a practice, and it's the art of medicine. So we're every day learning something new and changing and constantly adapting our practice to make sure that we're delivering the best care to our patients. And so in that case, I don't know how long ago that might have been. That might have been the recommendation, or maybe perhaps your practitioner is not super familiar with breastfeeding practices. It really, in the last few years, it's become its own specialty as well. So I think it's really important to give some grace that we're still humans, we're professionals, but we're still humans. And it's a lot of information to constantly be on top of, and we're doing our best to do that.
I guess as a kind of a follow-up to that question, is it fine to continue breastfeeding a baby if the mother gets pregnant during the breastfeeding time?
So yeah, you can continue to breastfeed. We've had some where they state that the breast milk changes or it feels, especially when you're coming down to deliver your baby, your body is going to do what's best for the baby that you're carrying, right? And so the consistency of the breast milk may change, that your toddler may not be used to anymore, may not want. So sometimes they wean on their own. But I've had lots of moms that come in and they're what we call tandem nursing, and they're nursing their toddler as well as the newborn, and it works just fine. Sometimes, the toddler wants to get in a little bit more frequently. You could be breastfeeding all day, but it just depends what works for your family, and we're here to support.
Yeah, that sounds intense. I think we have one more question. Are there any specific signs that indicate that a baby is not getting enough milk from breastfeeding?
Absolutely. And so as a pediatrician, the questions we're always asking you are how many poops and how many wet diapers? Like that's what we want to know. And the wet diapers tells us how much, if your baby's getting adequate nutrition from the breast milk, and we're looking at the weight, right? We're always weighing your babies to see if they're trending the way they're supposed to be going. We're looking at their head circumference, and we're looking at their length. So all of that information that we're gathering at the pediatrician's office, it's there to help us give us a good assessment to make sure your baby's on the right track for their growth.
All right. That seems to be it for our questions tonight. So I want to first thank Dr. Deveaux for taking time out of your busy schedule to give an awesome presentation on all of the important reasons why breastfeeding is helpful, beneficial both for mother and child, some tips about going through the process, and also some ideas for how the community, the workplaces, and all of these different areas can help to support breastfeeding mothers. Like you mentioned, Doctors Hospital does have a newborn and breastfeeding class that we are providing free of charge for Doctors Hospital prenatal patients. So at Doctors Hospital, our pediatrics team is here to guide you through the wonderful journey of parenthood with our free newborn and breastfeeding class exclusively for Doctors Hospital prenatal patients. So if you are interested in that program, if you'd like to get more information, you can contact us in Nassau at 302-3270 or at 302-3250, and in Freeport at 350-4490. And as always, if you want any more information, you can visit the Doctors Hospital website, and you can book appointments via clinics.doctorshosp.com. So thank you again, Dr. Deveaux, for your wonderful presentation. Thank you to our wonderful audience for all of your questions, your interest, your time. And we look forward to seeing you back here next time on the Doctors Hospital Virtual Distinguished Lecture Series.